Nurse Dawn here. I have been hanging out with Caitlin, the modern midwife, and her new little one, and we've been talking about various topics around maternal health care. So here you go. One of the things I've heard providers say the most is about delayed cord clamping. When patients want to delay cord clamping for longer than a minute, they talk them out of it like right at that moment in time, saying there's no benefits to that, or it's going to go back into the placenta.
I had one situation where a patient really wanted to deliver on a birth stool, and the provider did not want to deliver the baby there, which is so strange because she was a midwife, and midwives tend to be trained on how to deliver babies in whatever position. But she actually said, "Well, we can't do delayed cord clamping if you're on the birth stool."
Really?
Which is not true.
Not true
It's
at all.
just a straight lie. But that really bothered me but you know what? This patient, she did it anyway. She was like, fine, if you can't do it, that's fine. I'm just going to stay here. And of course, we, advocated for her to get delayed cord clamping as she wanted. So she got all the things that she wanted.
Right. And a lot of times it's interesting because, you have to wait for the placenta to separate anyway. So what's the rush in clamping and cutting the cord? I know if you have a good provider, they're willing to wait that extra minute or two. It's not like you're asking them to.
I think it's routine. I think it's a feeling of that habit, and also being uncomfortable with silence and with pause.
That's huge.
That's really what it is, I think, because when I'm there after having, caught a baby, it is not awkward, but it can be. It could feel awkward, I can imagine, for someone who's not used to giving that space. Because you're just kind of standing there waiting. Right. And 5, 10, 15 minutes for the placenta to come can feel like a really long time.
Yeah.
So, cutting and clamping feels like something you can do.
Right.
But that's not a good reason to do it. Just because we're uncomfortable with the wait.
Right. And we can, as nurses and providers, just sit in that silence and let the family have that time. We can make it awkward, I think.
Oh, for
more
sure.
often than not, if we just let them have their time with the baby and enjoy that. I mean, as a nurse, I've got charting to do, so I can be doing that while we're waiting. As a provider, you're
kind of just standing there. But that's the thing, is that you just have to get comfortable with that. To be a good provider that honors your patient's desires. But I mean, when I gave birth to him just a few days ago, my providers were being really respectful and honoring my desire to have at least 5 minutes of delayed cord clamping. And I remember thinking, because I don't know why, in that delirious kind of state, like I was like, a lot had happened. I wasn't thinking about why they were just kind of hovering, but it was them being respectful of the fact that I wanted that delayed cord clamping. And they waited way longer than 5 minutes, to the point where I had to be like, we can cut it now.
Yeah, you had to initiate it. Yeah, that's funny.